Now, I hope that gave you an opportunity to sort of start tying together some of these and put some of those learning patterns down for yourself. There are a few things that I was seeing and hearing, and I thought I might just address some of those things. Because sometimes when we're presenting, we're talking about Gestalt breastfeeding, others will say, oh, that's what we're already doing. But there's some real important fine details and more important things that we're not talking about in Gestalt breastfeeding that makes it so different. So some of the things I think you've already heard is we're not talking about women sitting upright or leaning over. We really are talking about that relaxed deck chair position. We aren't looking that when baby comes to the breast, it's almost, you know, they often get told, wait for the stars to align, you know, this big wide gape, the lining up exactly, nipple here, nose there, sort of thing. We're just talking about bringing baby onto the breast, and it's the power of what happens next. So we don't need to start dialing mum and baby up, waiting for that one moment. Some of the things we're talking about in the mechanics of breastfeeding is often adding in there just for a mum to notice her body and notice her breasts and where her breasts fall and where her nipples sort of point. That can be added into that first step as well. When we're talking about pillows to support mum and her arm and her back, we're not talking about breastfeeding pillows. So those lovely pillows that we can spend lots of money on, that strap on, because in fact they can lead to tissue drag if baby's positioned too high or too low to where mum's breast falls, and also can interfere with turning on the baby's reflexes as well. So those pillows that go out into a home and they've got there, they often usually just are used for the side to support mum's elbows or arms or even her back. Some of them are used for. We're not talking about lifting the breast, shaping the breast. What we're suggesting is that the breast falls where it's going to stay throughout that whole feed. Lips, we are not looking for these flanged lips. In fact, we'll say to mums that we don't even want to see the lips. We don't want to be digging around and drawing back breast tissue to check where they are. And some mums are doing that to say, oh, if they've got enough breast tissue in their mouth, I can see and I dig down. What in fact happening is that they're pulling breast tissue out of the baby's mouth whilst that's happening. So we don't want to see the lips, we don't want to know what they're doing. The other is breathing. So on that note, a lot of mums are worried when we're talking about bringing their baby so close is, what about breathing? I'm going to smother them, particularly the women who may lose a bit of visual or may have a more generous breast. So it's highlighting that it's not the concern that they're too close. We're looking that they just get some gentle pressure maybe between their shoulder blades that just will tilt their head and give their nose that little paper-thin space that it needs. But we really can reassure mums that we don't need to be concerned that they're going to be smothering them, and it's not because they've held so close, it's looking at those tiny little movements there for that. We're not talking about taking baby on and off and it's just one attempt, one go, and if it's not comfortable then we have to start all over again. That I'm sure you've gathered that it's those little tiny micro movements. So just bringing baby on and those little movements is our guide to and our way to get comfortable. We don't suggest massage or the breast compressions while feeding. Again, they're moving the breast, changing the breast. We can be drawing breast tissue out of the baby's mouth. Certainly massage before if that's what a mum's needing or wanting to do, but not during a feed. Pumping while feeding, it's, you know, we want to be efficient with our time and things like that, and our mums do as well, but that can really interrupt fit and hold if we've got a pump fitted on the other side while we're trying to fit the baby to the body. We're also talking, and I think we mentioned that before, babies aren't wrapped, hands aren't put in particular positions. We want those hands free and being able to hug the mum's breast. One or the other, and certainly not counting the sucks and the swallows that we were referring to before. So we want mums to be aware, particularly in the early days, that there's some suck swallows happening, but we don't want to be counting or timing them at all. We find the football hold is not something that we suggest to mums, purely because it's not sustainable for their posture long term, particularly as baby grows. And we often find that that reclining back position really does open up the lap a lot more and gives some more space so the baby's not resting on that caesarean scar. We do talk a lot about side-lying breastfeeds as well, so that's an option that mums often find comfortable, and it's actually something that I go through with most of the mums I see, the side-lying position there.
Is it worth asking Renee to run through the side-lying?
Yes, okay. Wish we could demo.
Can I just jump in there, because that is an important question about our post-cesarean section. But when they're reclined, as Renee's saying, that little one's wrapped right up under the breast, over the rib cage. We don't have issues around the wound hurting, and we don't have issues around how the post-birth rounded tummy impacts on the biomechanics either. Sorry.